Welcome to Everyday Health Stories by Dr. Kota Reddy, the podcast where we explore the fascinating world of medical science through the power of storytelling. Each story reflects extensive encounters with patients, sharing fascinating tales of health struggles and recovery, along with the valuable lessons they've imparted. Before we begin, hit pause for a moment and click on the follow button. By following, you'll receive updates on our latest episodes, get access to exclusive content, and join a community of listeners transforming their health one story and one micro habit at a time. Please remember that this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare provider for any medical concerns. Today, we'll delve into a compelling case study that highlights the profound connection between emotional distress and physical health. The story you are about to hear is based on an actual patient, though some details have been changed to protect their identity. This is broken heart syndrome, the immediate effect of emotional stress on cardiac health. One rainy morning, a young woman of only 36 was urgently admitted to our hospital, her situation critical and puzzling. Her cardiac enzymes, alarmingly high, were a harbinger of severe heart issues. The EKG output only deepened the mystery, showing nonspecific changes that hinted at, but did not confirm, a heart attack. Given the severity of her condition and her young age, we were propelled into action with a mixture of urgency and concern. To get a clearer picture of her cardiac function, we performed an echocardiogram. The results were startling. Her heart function was critically reduced to 20% or less, a condition rarely seen in someone so young without a history of cardiac issues. This anomaly led us to expedite her transfer to the cath lab for an angiogram. Contrary to our fears, the angiogram revealed clean arteries, ruling out coronary artery disease as the cause. Her heart was failing, yet the usual culprits were conspicuously absent. Given the lack of facilities for advanced heart failure management in our hospital at that time, we transferred her to St. Luke's, a decision spurred by the pressing need to save her life. At St. Luke's, she was immediately put on a mechanical support device to aid her heart's function. Over the next 2 weeks, a medical marvel unfolded. Her heart function began to recover. 6 weeks later, she returned to my office, her smile as bright as the news she brought. Her heart function had completely normalized. During her follow-up visit, she shared her backstory, adding layers of complexity to her medical mystery. She worked as a nurse in the ICU, a job that demanded resilience and emotional strength. Her personal life, however, had recently unraveled. She had endured a painful breakup with her boyfriend, a split that she found devastating. Unable to cope with the emotional turmoil, she had attempted to end her suffering through an extreme act, injecting herself with an EpiPen. The massive dose of epinephrine triggered a catastrophic stress response in her body, severely affecting her heart muscle, escalating her cardiac enzymes, and plummeting her heart function. This case was a turning point in my career, a poignant reminder of the profound connection between emotional distress and physical health. It exemplified what has come to be recognized as stress-induced cardiomyopathy. As I reflect on this and similar cases I've encountered since then, where patients' heart functions dramatically decreased under the influence of acute stress and then recovered, I'm constantly reminded of the delicate balance we must maintain in our lives. Stress, especially sudden and severe, can wield a destructive power over our hearts, metaphorically and literally. The moral of these stories is profound yet simple. The human heart is susceptible not only to physical ailments, but also to the emotional upheavals of our lives. Understanding this, we should approach our daily challenges with a mindfulness that cherishes and protects our heart health. Let each day be a reminder to manage stress and to foster resilience for the sake of our hearts and our overall well-being. That was quite a captivating story, wasn't it? Now, let's take a moment to understand stress-induced cardiomyopathy, also known as broken heart syndrome or Takotsubo cardiomyopathy. It is a transient heart condition that is often precipitated by intense emotional or physical stress. The heart muscle suddenly weakens, leading to symptoms similar to those of a heart attack, such as chest pain, shortness of breath, and arrhythmias, but notably without the coronary artery blockage typically seen in heart attacks. The hallmark of this syndrome is a temporary ballooning and dysfunction of the left ventricle, the heart's main pumping chamber. The condition was first recognized in Japan in the 1990s and is named after the Japanese word for octopus pot, which resembles the shape of the stressed ventricle. Despite its dramatic presentation, the condition is usually reversible, with most patients fully recovering within weeks with appropriate medical treatment and stress management. Let's transition to something actionable that can make a difference. Consider the importance of immediate steps to manage emotional stress effectively. Recognize the onset of emotional outbursts and employ calming actions to prevent escalation and protect your physical health. For example, when you feel frustration or anger rising, pause what you are doing. Initiate deep breathing exercises by slowly inhaling through your nose and exhaling through your mouth. Repeat this 5 times to stabilize your physiological response and clear your mind. After calming your breathing, reflect on what triggered your reaction, considering a more measured response to the situation. If possible, conclude with a short meditation or mindfulness exercise to further reduce stress and refocus your thoughts positively. This practice not only aids in immediate stress relief, but also builds long-term resilience against emotional stressors, safeguarding your heart and overall well-being. Thank you for joining us on this journey through the young woman's life and her remarkable recovery. Her story teaches us that the heart is not only vulnerable to physical ailments, but also to the profound impacts of emotional stress. Her experience reminds us of the deep connection between our emotions and our physical health. As we reflect on her tale, let's remember the importance of recognizing and addressing our own stressors. Her courage to face her health challenges head-on and make necessary changes can inspire us to do the same. By managing our stress and taking care of our emotional well-being, we can protect our hearts and improve our overall health. Let her story be a reminder that we have the power to make positive changes in our lives. By fostering resilience and mindfulness, we can safeguard our hearts and lead healthier, more balanced lives. Let's be inspired by her journey and commit to making healthier choices for ourselves and those we care about. Please note that the content shared in this podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. For the full disclaimer, please visit our website. Until next time, be kind to yourself, prioritize your well-being, strive to be the best version of yourself, and keep listening to Everyday Health Stories by Dr. Kota Reddy. Remember, every story has the power to transform lives. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss out on our latest stories and health tips. Are you ready to take control of your health and make a lasting change? For premium content and in-depth guidance on how to prevent and reverse medical conditions like hypertension, hypercholesterolemia, diabetes, fatty liver disease, obesity, dementia, and more, all through complete lifestyle and diet modification, without medications, supplements, or interventions. Visit getreadytoday.com to learn more about joining Dr. Reddy's Eat This, Lose That program. You can also call Dr. Reddy's office at 281-491-0044 for more information. Take the first step towards a healthier you today. Stay tuned for a sneak peek into our next episode. Imagine feeling your heart speak to you in a language you can't quite decipher. Gentle nods, frantic rushes, a code of beats that leaves you in a state of confusion and fear. In our next episode, we dive into the mysterious world of heart palpitations through the story of Clara, a dedicated librarian whose life is turned upside down by these puzzling sensations. As Clara navigates the tension between her body's cryptic messages and the looming threat of serious heart issues, we'll uncover the crucial steps she takes to unravel this medical enigma. With the stakes high and every beat a potential clue, Clara's journey is a testament to the power of precise communication and the resilience of the human spirit. Join us next week as we explore from head nodding to tail wagging, deciphering the hidden messages of heart palpitations. Will Clara's heart reveal its secrets in time? You won't want to miss this gripping tale of medical mystery and discovery.